If you feel a sudden, urgent urinary leak coming on, your very first instinct is probably to just clench every single muscle in your lower body and sprint to the bathroom as fast as humanly possible.
Right. Yeah.
I mean, it's a completely natural reaction, but what if I told you that sprinting is actually, well, the absolute worst thing you can do for your bladder?
It is entirely counterintuitive.
Yeah.
But from a neurological and mechanical standpoint, that frantic dash to the toilet is practically guaranteeing the exact outcome you're trying so hard to avoid.
Welcome to the deep dive. If you're dealing with urinary leaks, you already know how restrictive and honestly frustrating the diagnostic landscape can be. It's just murky.
Well, very murky, yeah.
So today we're looking at a stack of urology guidelines, clinical reviews, and physical therapy protocols to answer a really specific, really empowering question for you. How do simple lifestyle modifications and dietary changes reduce the bladder irritants that are actively compounding your underlying stress incontinence leaks?
Yeah, and we really need to move past this traditional, binary view that incontinence is just a weak muscle problem or like a simple mechanical failure.
Right.
It's actually a highly dynamic environment. It's influenced heavily by chemical triggers, sensory nerves, and even the physical mass of what is going on in your digestive tract.
Wow.
So by the end of our conversation today, you'll have a really practical roadmap to untangle what exactly is irritating your bladder and how to regain control.
I love that. To build that roadmap, though, I feel like we have to start with the physical and chemical mechanics of, well, why the leaks are happening in the first place.
Definitely.
Let's establish the structural baseline, starting with stress urinary incontinence, or SUI. And we know the word stress here isn't about, like, emotional panic, right? It's about physical strain.
Correct, yeah. Stress urinary incontinence is fundamentally a mechanical issue.
Okay.
This is the involuntary leakage that happens during physical exertion. So, coughing, sneezing, laughing, jumping, or even just lifting heavy objects.
Yeah.
It happens when your intra-abdominal pressure suddenly spikes, and it essentially overpowers your urethral resistance. Normally, the pelvic floor muscles in the urethral sphincter, they act as a secure valve.
Like a seal.
Exactly, like a seal. But if that support system is compromised, whether that's from childbirth, pelvic surgery, or an intrinsic sphincter deficiency where the internal valve mechanism itself is degraded, that sudden spike in abdominal pressure essentially forces the door open.
So that covers the mechanical failure side of the equation. But then we have the sensory side, right? Urge incontinence, or UUI, which the sources say is inextricably linked to overactive bladder.
Yes, urge incontinence is a sensory and neurological issue. So it presents as this really sudden, intense, almost panicky need to urinate, which is often followed immediately by involuntary leakage.
Oh, wow. So what's happening biologically there?
Well, the detrusor muscle, which is the smooth muscle that forms the wall of the bladder, it begins contracting uninhibitedly. It's firing off squeeze signals when it shouldn't be.
Just totally rogue.
Exactly. And completely independent of how full the bladder actually is.
Okay, so we have the mechanical weakness of stress incontinence on one hand, and the rogue, uninhibited muscle contractions of urge incontinence on the other. But you don't just get to pick one from the menu, right?
I wish.
Yeah. Many people, particularly women, are dealing with both simultaneously.
Yeah, that is mixed urinary incontinence, or MUI, and it is incredibly prevalent. The clinical data shows that more than 37% of older female patients with incontinence face this compounded issue.
37%. That's huge.
It is. And there's a clear physiological reason why it affects women over 65 so heavily. It's kind of the perfect storm of hormonal and structural shifts.
Because of menopause.
Exactly.
Yeah.
As estrogen levels drop post-menopause, the tissues in the pelvic region actually lose their elasticity and vascularity. So you have structural wear and tear compounding with a neurological sensitivity that just makes the bladder hyperreactive.
I was reading through the clinical reviews, and I kept picturing the bladder as a water balloon.
Okay, I like that.
Like, if you have stress incontinence, it's like that water balloon has a slightly loose knot tied at the end. So when you jump or sneeze, gravity and pressure force a little bit of water out of that loose knot.
That perfectly illustrates the, intra-abdominal pressure overcoming the weakened valve.
But if you also have urge incontinence, it's like someone is randomly squeezing the middle of that balloon with their hands all day long.
Right.
So if we can just stop the random squeezing, which represents the chemical and physical irritation of the bladder, then that loose knot doesn't get tested nearly as violently or as often.
That visualization captures a core clinical approach in urology perfectly. Because even if the underlying structural weakness remains, that loose knot of stress incontinence, treating the hyperactive, irritated side of the bladder drastically reduces the overall burden of your leaks.
Makes total sense.
Yeah. When we quiet the sensory panic, the mechanical weakness isn't exploited nearly as frequently.
Okay, so moving from why the balloon is being squeezed to what is actually doing the squeezing chemically, we need to identify the culprits in your diet causing that irritation.
A fun part.
Yeah, exactly. So the Brigham Urogynecology group highlights what they call the top offenders. And we are looking at alcohol, tobacco, cola drinks, tea, artificial sweeteners, chocolate, and coffee.
They are definitely the heaviest hitters when it comes to bladder irritation. And, unfortunately for those with a sweet tooth, chocolate is particularly troublesome.
Oh no, why chocolate?
Well, because it contains methylxanthines, which act very similarly to caffeine combined with sugar, or even worse, artificial sweeteners if it's like a diet product. It becomes a triple threat.
Like, and I want to dig into the why here. What is actually happening on a cellular level when I drink a cup of dark roast coffee or, I don't know, eat a spicy taco? Why does the bladder even care?
We really had to shift our understanding of the bladder. Historically, it was viewed as a passive reservoir, just a storage bag for waste.
Right, like a literal bag.
Yeah, but the inner lining of the bladder, the urothelium, is a highly active, incredibly intelligent tissue layer. It is densely packed with specialized cells and sensory nerves that are constantly monitoring the chemical composition of your urine.
Wow.
And it's in direct, constant communication with your central nervous system.
Wait, so it's actively analyzing the urine while it just sits there?
Yes.
Yeah.
Let's take your spicy taco example. Chili peppers contain capsaicin. When those compounds are metabolized and excreted into your urine, they come into direct contact with the urothelium.
Okay.
And the urothelium features specific receptors known as TRPV1 receptors. These are literally designed to detect heat and pain.
Oh, I see where this is going.
Right, so when capsaicin binds to these receptors, it triggers a false alarm. It sends a distress signal to the brain that translates as intense urgency, frequency, and discomfort.
That's wild.
Yeah, your brain interprets this chemical signature as a literal emergency, causing that uninhibited detrusor muscle contraction.
So the bladder isn't just full, it's experiencing a localized chemical burn signal, and the brain's reaction is to try and evacuate the irritant immediately.
Exactly.
That makes so much sense. And the sources point out it's not just spicy foods or the main offenders. Citrus fruits like oranges and grapefruit, tomatoes, carbonated drinks, and even high water content fruits like watermelon can trigger this same alarm system in sensitive individuals.
Right, because the acidity in tomatoes and citrus alters the pH of the urine just enough to agitate those sensory nerves.
And what about the carbonated drinks?
With carbonated drinks, the dissolved carbon dioxide creates carbonic acid, which again lowers the pH and irritates that urothelial lining.
Okay, that brings up a massive contradiction in popular culture that I really have to push back on.
Let's hear it.
If acidity is the enemy of a sensitive bladder, why are we always told to chug cranberry juice the second we feel a twinge?
Oh man, we need to completely demystify the cranberry juice narrative. It is one of the most pervasive and frankly damaging myths for people suffering from overactive bladder or mixed incontinence.
It really is the universal folk remedy, though. Everyone says to do it.
I know. Here's where the confusion started. Scientists identified a specific substance in cranberries called proanthocyanidins, which can prevent certain strains of E. coli bacteria from adhering to the bladder walls.
Okay, so it does do something.
It does. That's why it became famous as a preventative measure for urinary tract infections. However, clinical research does not support it as a treatment for an active UTI.
Oh, okay.
But, much more importantly, if you are dealing with an overactive or sensitive bladder, cranberry juice is like rubbing salt in an open wound.
Just because of the massive acid load?
Yes. The high acidity combined with the heavy fructose load, because, commercial cranberry juice is packed with sugar to make it palatable. It creates a highly concentrated acidic urine.
So you're just making it worse.
Much worse. It will dramatically escalate your urgency and frequency symptoms. You are feeding the irritation directly.
That is a total paradigm shift. So if we are dumping the cranberry juice, what are the safe fruits that won't trigger the chemical alarm system?
You want to look for fruits with a lower acid profile. So things like blueberries, pears, bananas, papaya, and apricots are generally very well tolerated by the urothelium.
All right, so we've mapped out the chemical triggers, the things we consume that make the bladder panic. But the clinical sources also dive deep into what happens when the things we don't consume cause problems.
Right.
Let's transition from chemical triggers to the physical laws of volume and mass, the hydration paradox.
This is such a vicious cycle. When you suffer from incontinence, the most logical, self-protective instinct is to just restrict your fluid intake. The thought process is entirely rational. If the tank is empty, it cannot leak.
But biologically, that instinct completely betrays you.
It backfires on a chemical level. If you consume too little fluid, say under a liter a day, your body still has to filter toxins and excrete waste.
Of course.
Consequently, your urine becomes highly concentrated. It turns dark amber, and the osmolarity spikes. This high concentration of solutes acts as a potent chemical irritant to the bladder lining.
So the urothelium detects this concentrated waste and panics again.
Exactly, which worsens the detrusor spasms and the urgency.
So by trying to prevent a leak, by dehydrating yourself, you are chemically forcing the bladder to squeeze more aggressively.
Bingo.
But on the flip side, a study from Bristol highlighted in the urology sources showed that overhydrating is equally problematic.
Yes. Consuming excessive fluids, particularly over 3 liters a day, simply overfills the bladder. If you have that weakened mechanical valve of stress urinary incontinence, and you're carrying around a completely full, heavy bladder, the moment you exert yourself, you're going to leak.
It's just too much volume.
Right. The physical weight and sheer volume of the urine easily overwhelm the compromised pelvic floor.
It sounds like trying to inflate a bicycle tire without popping it. You need enough air to roll smoothly, but not so much that it bursts under the slightest pressure.
That is a much more accurate way to look at it. The clinical sweet spot for most adults is roughly 1.5 to 2 liters, or about 40 to 60 ounces of non-fizzy water daily.
How do you know if you're hitting that sweet spot?
Your visual cue is the toilet bowl. You are aiming for pale, straw-colored urine. That indicates the urine is dilute enough to prevent chemical irritation, but you aren't overloading the bladder's mechanical capacity.
And there's another physical element here that's heavily dependent on hydration, and it's something people really shy away from discussing.
Constipation.
Yes, constipation.
When we look at pelvic anatomy, the relationship between the bladder and the bowel is impossible to ignore. They share a very cramped neighborhood. The bladder sits just anterior to the rectum and the sigmoid colon, and they all rest on the exact same muscular hammock of the pelvic floor.
So if you aren't drinking enough water and your dietary fiber is low, things get backed up. And that creates a massive physical problem.
A full impacted bowel is a major mechanical irritant. The sheer physical mass of the stool sits directly against the dome of the bladder.
Yikes.
Yeah, it adds constant heavy pressure to the pelvic floor muscles, which exhausts them. It literally physically restricts the bladder from expanding as it fills, which artificially increases urgency.
I didn't even think about that.
Now, consider what happens when you sneeze or cough while having a hard, full bowel pressing down on a full bladder.
Oh, wow. That intra-abdominal pressure is magnified exponentially, and the stress incontinence leak is going to be severe.
Exactly.
So if we are trapped between the chemical irritants of our diet and the physical pressures of hydration and digestion, how do we actually map our way out of this? Where does a person even start to take back control?
You start by gathering personalized data. You need a bladder diary. You really cannot manage a condition if you do not measure its variables.
The clinical guidelines suggest running this diary for 3 to 7 days, and it requires much more detail than just noting when you visited the restroom.
Way more detail.
You have to track every input and every output. You're recording the time of day, the exact type of beverage, the volume consumed, and your level of urgency on a numerical scale.
Crucially, you must document the specific leak triggers. What was your physical state when the leak occurred? Were you laughing? Were you just sitting still and suddenly felt a wave of urgency? Did it happen exactly 30 minutes after drinking a Diet Cola? The diary is the diagnostic tool that will reveal your unique chemical and mechanical irritants.
Because, as the research emphasizes, these triggers are highly individualized. You might be completely unbothered by a tomato salad, but absolutely ruined by a cup of green tea.
Precisely.
Once you have a few days of solid data, you move to the elimination diet.
Yes, once you suspect specific triggers based on your diary, you eliminate them entirely for 1 full month.
See, a full month feels like a very long time just to test a theory. Why not just like a few days?
Because a bladder flare isn't just a momentary irritation. It involves lingering neurogenic inflammation. The sensory nerves in the urothelium become sensitized and hyperreactive.
Oh, so they stay angry.
Right. It literally takes weeks for that neurological inflammation to calm down and reset to a baseline state. If you only stop drinking coffee for 3 days, the inflammation is still present, and you won't experience the true relief.
Okay, that makes sense.
After a month of a clean, bladder-friendly diet, you enter the reintroduction phase. You add back one suspected item at a time, testing it over a 3-day period to gauge your bladder's specific reaction.
So you are systematically proving to yourself what your urothelium can and cannot handle.
Exactly.
But dialing in your diet is only half the battle. We also have to discuss bladder retraining, which starts with breaking a habit that almost everyone with incontinence develops, and that's the just-in-case voiding habit.
This is a critical behavioral shift. Many people develop the habit of using the restroom every single time they pass one, just in case they might need to go later.
Oh yeah, I definitely do that before a long drive.
We all do. But over time, if you do it constantly, this actually trains your bladder to hold less and less urine. You are artificially shrinking your functional capacity, which makes the neurological urgency worse.
Wow, so how do we fix it?
Bladder retraining involves scheduling your bathroom trips, perhaps starting at every 2 hours, and strictly adhering to that timetable, gradually increasing the intervals over time.
But that brings us right back to the very beginning of our deep dive. What happens when that intense, burning urge is entirely out of schedule?
Right.
The clinical protocol suggests something that feels so unnatural. When I feel a leak coming, I want to rush to the bathroom. You're telling me to stand perfectly still and do math in my head.
I know it sounds ridiculous, but yes, sprinting drastically increases your intra-abdominal pressure, which basically guarantees a stress leak.
Right.
Furthermore, the frantic rushing feeds the neurological panic loop in your central nervous system, which amplifies the urge leak. Your detrusor muscle goes into absolute overdrive.
So what is the actual step-by-step protocol for this stop and Kegel method?
When the sudden urge hits, you immediately stop moving. You stand perfectly still or ideally sit down on a foam surface. Then you perform 5 quick, forceful pelvic floor contractions known as Kegels.
Just 5 quick ones.
Yes. You are isolating the pelvic floor, pulling up and in like you're trying to stop the flow of urine or hold back gas. You are not bearing down, and you're not squeezing your glutes or your abdominals.
Okay.
While you do these 5 quick foot contractions, you use active mental distraction. Counting backward from 100 by 7s is a classic technique.
I really want to understand the mechanism here. How does doing 5 quick muscle contractions help if the bladder muscle is already violently spasming?
It utilizes a physiological reflex arc. When you consciously rapidly contract the pelvic floor muscles, it sends an inhibitory signal straight up the spinal cord to the detrusor muscle.
Like an off switch.
Exactly. It is a biological override switch. The nerve signal generated by the pelvic floor contraction forces the bladder muscle to relax. You are breaking the neurological panic loop and proving to your brain that your voluntary muscles control the bladder, not the other way around.
The physical contraction of the pelvic floor sends a nerve signal that forces the rogue bladder muscle to stand down. That is incredible.
It really is.
And the sources point out that engaging in regular, proper pelvic floor muscle training over time can yield up to a 70% improvement in stress urinary incontinence symptoms overall.
A 70% improvement is a massive clinical success rate for an entirely non-invasive behavioral intervention.
And there is one more behavioral tweak that is so incredibly simple but vital for pelvic health: toilet posture. We have to stop hovering over public toilet seats.
Oh, please stop hovering. The biomechanics of hovering are terrible for your bladder.
Why is that?
When you hover, you are heavily engaging your core, your glutes, and your pelvic floor muscles just to maintain your balance. If those muscles are actively engaged, they cannot relax.
Oh, right.
And if the pelvic floor doesn't fully release, the sphincter doesn't fully open, and the bladder cannot completely empty. This leaves residual urine behind, which leads directly to frequency, urgency, and a significantly higher risk of bacterial infections.
That makes total sense.
You must sit down with your feet completely flat on the floor to allow the pelvic floor to fully release.
So put some toilet paper on the seat and just sit down flat. Let's recap this roadmap. We started by separating the mechanical weakness of stress leaks from the sensory hyperactivity of urge leaks, understanding how they compound each other.
Right.
We unmasked the chemical irritants, discovering how capsaicin, acidic tomatoes, and the sugar acid bomb of cranberry juice actively burn the sensory nerves in the bladder lining. We learned how to inflate the hydration tire, perfectly aiming for pale, straw-colored urine to prevent the physical crush of constipation.
Yes.
And finally, we built a toolkit. Charting the data with a bladder diary, starving the inflammation with an elimination diet, and overriding the neurological panic reflex by standing still, doing math, and firing off 5 quick Kegels.
It is a really comprehensive, empowering approach that puts the control directly back in your hands. But before we finish, there is a fascinating cutting-edge thought straight from the most recent research in our clinical sources that I really want to share.
Ooh, let's hear it.
We have spent a lot of time today discussing diet, the inputs we actively control. But recent data has started looking at the unavoidable environment we live in. The research reveals that exposure to heavy metals, specifically elevated levels of lead and cadmium found in blood and urine samples, is positively associated with stress incontinence in younger and middle-aged women.
Wait, environmental heavy metal exposure is linked to urinary leaks.
It appears so. The toxicological burden on the body seems to degrade pelvic floor health and tissue integrity.
That is wild.
It gets better. Interestingly, the same research demonstrated that maintaining high levels of HDL cholesterol, the good cardiovascular cholesterol, actually seems to offer a protective effect against developing stress incontinence.
That forces us to completely rethink the boundaries of pelvic health. I mean, could the future of treating urinary leaks involve not just tracking our morning coffee intake or practicing pelvic floor contractions, but actively detoxing from environmental metals and managing our systemic cardiovascular profiles?
It strongly suggests that pelvic floor health is not an isolated mechanical system. It's inextricably linked to our overall systemic health and environmental exposure. It's a really profound concept for you to consider as you go pick out a notebook to start your bladder diary.
It just proves how interconnected every single system in the human body truly is. The muddy waters are finally starting to clear up. We've gone from looking at incontinence as a binary, broken system to understanding the complex, highly manageable chemistry and physics that actually control it. Thank you so much for joining us on this deep dive. We hope this empowers you to stay curious, challenge the myths, and take back control of your health one habit at a time.